Name 20 symptoms of rheumatoid arthritis that have nothing to do with joints. I'll go first. Hi friends, my name is Dr. Erin Carter. I'm a rheumatologist, and many people think that rheumatoid arthritis only causes joint pain and swelling, but in reality, it can do so much more than that. So let's get into it. Rheumatoid arthritis can also cause significant fatigue as well as weight loss in some patients. It can also lead to thinning of the bones or low bone density, and this includes both the bones of your skeleton as well as your teeth. And now I'm gonna go head to toe, so just bear with me here. So it can affect the eyes. And it can actually cause many different changes in the eyes, including scleritis, episcleritis, iritis, uveitis, ulcerative keratitis, and extremely rarely but possible is something called corneal melt. Now, patients with rheumatoid arthritis can also develop what's called secondary Sjogren's syndrome, which can cause dry eyes and dry mouth. Now, rheumatoid arthritis can actually affect the larynx, so the joints in your throat as well. And this can lead to something called cricoarytenoid arthritis. I haven't actually seen this in my practice yet because it's extremely rare, but it is possible. Now, rheumatoid arthritis can affect the lungs in many different ways. It can cause pulmonary nodules, it can cause pleural effusions, so basically fluid in the lungs. It can cause pleuritis, and it can also lead to something called interstitial lung disease. It can also affect the heart, and this can manifest in a few different ways, including coronary artery disease, myocarditis, pericarditis, and rarely patients can actually develop rheumatoid nodules on the heart itself. Speaking of rheumatoid nodules, patients can also develop rheumatoid nodules, which are basically little masses or lumps under the skin that most commonly occur over certain joints. So elbows are a common place to see them, knuckles of the hands are also very common, and sometimes the knees as well. Now, it can also lead to a number of different hematologic or blood work abnormalities, and most commonly we see anemia, but it can also lead to neutropenia, and rarely there's a condition called Feltes syndrome, which is a combination of rheumatoid arthritis, neutropenia, so low neutrophils, and an enlarged spleen. And then leukemia is also more common in patients with rheumatoid arthritis. It can also affect the nerves in various ways, so it can lead to neuropathies. For example, carpal tunnel is a common neuropathy that we see in our patients, but it can potentially affect other nerves in the body as well too. It can also lead to rheumatoid vasculitis, which is inflammation of blood vessels. And then it can also affect the skin in many different ways, and many types of skin rashes are more common in patients with rheumatoid arthritis. And some of these include pyoderma gangrenosum, skin ulcers, Sweet syndrome, as well as rheumatoid neutrophilic dermatosis. And rarely it can also affect the kidneys in a few different ways, including a glomerulonephritis, which is basically kind of inflammation in the kidneys. If patients develop rheumatoid vasculitis, that can also potentially affect the kidneys. And then we don't see this very commonly anymore because we have better therapies for rheumatoid arthritis these days, but historically, patients could also develop something called amyloidosis, which is basically uncontrolled inflammation for long periods of time, which could also affect the kidneys. Another thing that's more common in these patients is fibromyalgia or soft tissue pain. And this is pain